Hello, I'm Dr. Stephen Forman. I'm an interventional cardiologist and the director of the Cardiac Catheterization Lab at Los Alamitos Medical Center. Cardiology is the study and treatment of heart disease. Interventional cardiology is a subspecialty which involves treating certain heart disease with invasive procedures. The Center of Interventional Cardiology at Los Alamitos is the Cardiac Catheterization Lab. How might you find yourself in the catheterization lab? It would usually be one of two ways. Either an emergency procedure because you are having a heart attack, or an elective procedure because you are having symptoms. Let's start from the beginning. Here is your heart. Your heart is sitting in the middle of your chest. It's about the size of your fist. The heart pumps blood out to the rest of the body. On the surface of the heart, there are blood vessels called arteries, in red here, and those are bringing blood back to the heart muscle. When those blockages occur, the heart does not get enough oxygenated blood, and that's when you have problems. And you can have one of two problems, either symptoms, which is called angina, or you can have a sudden closure of one of those arteries, which would then cause a heart attack. In either of those situations, you'd need the services of an interventional cardiologist. Okay, so now let's take a look at the inside of the arteries. If we look at the images here, the first image shows a normal artery. So there's no buildup of any kind of cholesterol plaque. There's no blockage. There'd be normal blood flow through that. On the second image, that is a situation where there is a small amount of buildup of plaque, which may or may not cause you any symptoms. The third image is an artery that is now completely blocked, and in that situation, that would cause a heart attack. And the final picture here is after the heart attack has actually occurred. What an interventional cardiologist wants to do is open up these blockages to restore blood flow into the arteries and down to the heart muscle. The way we do that primarily is by doing a procedure called an angiogram or cardiac catheterization. That procedure involves putting a catheter into one of the arteries, either in the leg or the arm, and then running longer catheters up to the heart. This is the catheter that would go into the leg or the wrist that then allows us to pass our longer catheters through. This is one of the longer catheters, and the way they're made, they're very long. They're about 3 feet long. They go in through the catheter in the leg. We then run them up to the heart. There are different shapes on the tip of the catheter that fits into one of the heart arteries. Once that catheter is in position, we can inject dye down the arteries and then see whether or not there's a blockage in any of the blood vessels. Assuming there are a blockage, then we can go ahead and fix that. The way we would do that is pass a different catheter up that's slightly larger in diameter up to the same artery. We can then pass a little wire down the artery across the blockage. We then inflate a balloon to open the blockage up. And then ultimately, we would put in what's called a stent. Stent's a little metal tube. This is an enlarged version of a metal tube that goes inside the artery, and that holds the artery open. That works like scaffolding in a mine shaft. So it keeps all the stuff, the cholesterol plaque, out of the way and allows the blood to pass through. Once that's done, the heart muscle then will get normal amount of blood supply, and whatever problem we're treating is going to be solved. When I started, I said you might be in the cardiac catheterization lab one of two ways, either with a heart attack or by an elective procedure. If you had a heart attack, you would likely wind up in the emergency room, either by ambulance, preferably by ambulance. The ER staff would identify that you were having a heart attack. They would call interventional cardiology. We would get in as quickly as possible, because the sooner we can do one of these procedures, the better it is for you. We want to do these procedures generally within 90 minutes of the time that you reach the door of the emergency room. Once we've identified the problem, we bring you to the cardiac catheterization lab and we do the procedure I just described. That whole thing, again, is usually done within 90 minutes from the time that you would make it to the emergency room. You would then wind up in the hospital for a few days after that. Assuming that it was not a heart attack, but you were there because you were having symptoms called angina, you may have been to your cardiologist office, general cardiologist, or a primary care doctor. You may have been complaining of shortness of breath or chest pain. They then would have done a workup, which would likely have included some type of stress test, either a treadmill or a nuclear test. Once those tests come back abnormal, that's an indication that there's a blockage, and then you would proceed to an interventional cardiologist who would then bring you to the catheterization lab to do a angiogram as I just described. Here at Los Alamitos Medical Center, we provide a full array of general cardiology and interventional cardiology services. Thank you for choosing Los Alamitos for your care. I am Dr. Stephen Forman. Thank you.